My name's Alan Glasser. I'm a pharmacist, Mark's Pharmacy, Delta, BC in Canada. And right now I like to review the top prescribed medications and specifically the side effects that you can encounter when you take them. You know, all prescription drugs have more than one effect. There's the effect the physician wants you to get in terms of reducing your disease state, reducing pain. In this case, mostly we're related with pain with arthritis, and they all have side effects. So let's get into the most commonly prescribed drugs by the specialists for control of arthritis. Vicodin, or that's hydrocodone and acetaminophen. In Canada it's called Endocet, Percocets. Hydrocodone. You're looking at a potent narcotic. The classic, and it is addictive, meaning that if you start taking it when you don't have pain, yes, you're addicted to it. When you do have pain, there's actually studies proving that once the pain goes away, you can stop your hydrocodone or Vicodin or Endocet or Percocets, and there's no long-term addiction to this. So typical with hydrocodone or oxycodone: nausea, vomiting, constipation. Those are the top three things that happen. If you are constipated, you must get a stimulant laxative. I strongly recommend the Senecod or Senna and a stool softener. You can take those safely. There is no dependence on stool softeners. Once you get rid of the cause of your constipation, you can stop the stimulant laxative. The next drug is relatively new. It's similar to the action of Tylenol 3s on narcotic, but it doesn't have all those side effects, which is usually drowsiness, nausea, constipation, addiction. Again, the top three things that happen with people, 4 or 5 people out of 100 taking the tramadol or Ultram, is nausea, vomiting, and constipation. Again, doesn't happen to everybody, 5 or 6 people out of 100. Typically this is either given by itself or along with acetaminophen to control your pain. My only concern is your dose is related with too much acetaminophen. The maximum dose for anybody over 65, 70, and I strongly recommend, is 3,000 milligrams of acetaminophen a day. If you're taking more than that, there's new studies out saying you're risking liver damage, and we won't want you to damage your liver. And if you're concerned about that, you can get liver enzyme tests to see if there is any liver damage that you've suffered. The next drug we're going to look at is meloxicam. It's called Mobic, or in Canada you see the generic meloxicam. It is like aspirin. So the typical things is upset stomach, nausea, possibly drowsiness or diarrhea. Those are the top three things 5 or 6 people out of 100 experience. To reduce that chance, you need to take this drug after food or milk. Unfortunately, with this whole class called NSAIDs, there's guaranteed to be 1 person per 100 who has a stomach bleed when they're on these. That's the danger of them. That means it's beyond, your stools either turn black or you vomit coffee grounds, it looks like. If that ever happens to you, get to emerge. Just they investigate that, make sure it's not life-threatening, a bleeding ulcer. The next drug we're going to look at is similar to the meloxicam, but it's the next generation, so fewer side effects. It's called Celebrex, and stomach upset or gas may occur. Those are the most common problems. I will tell you, one of the issues here is it does cause blood clots in a small number of people. Obviously that means stroke, heart attack, kidney failure, and that's why it is used with caution. As a matter of fact, any of the non-steroidal anti-inflammatories can cause that problem. Again, it's a risk-benefit situation here when you're using these class of drugs, because it's so effective at controlling your pain. We want to give you mobility and a life, even if you have arthritis. Part of arthritis is muscle or joint pain. That's why the next drug that's given is cyclobenzaprine, which is called the brand name Flexeril. Typical things with this is drowsiness, dry mouth, fatigue, dizziness, lightheadedness. because it's changing those areas. Again, 5 or 6 people. It's not everybody who experiences this. I think the most common side effect is the dry mouth and drowsiness. Drowsiness could be up to 50% in this particular case. So avoid driving, avoid alcohol, avoid other drugs that increase your drowsiness, because it'll just get worse. Again, it's a relatively safe drug, but you got to watch the side effects. When you're taking this with, there's a possible drug interaction with antidepressants, so check with you. If you're taking antidepressants, you may not want to take too high a dose of Flexeril because it increases the potency of your antidepressant. The top selling pain control agents are Tylenol. Number 1, I strongly recommend you take no more than 3,000 milligrams a day if you're over 65, and that's because the latest information is telling me that patients who are taking over 3,000 milligrams of acetaminophen or Tylenol daily are suffering liver damage. It increases your risk of liver damage. I know that we do no longer give our patients in nursing homes more than 3,000 milligrams a day. We use other means to control their pain. Below 65, it's safe to take 4,000 milligrams of acetaminophen or Tylenol daily. And that's the biggest concern, is liver damage over long-term chronic use. Ask your doctor to be tested to see if you're suffering anything like that. The other 3 drugs are Advil or ibuprofen, aspirin or ASA, and Aleve, which is naproxen. These are over-the-counter drugs. They're all the same class of drugs. They have similar side effects in terms of upset stomach, stomach pain, diarrhea. The long-term problem with these drugs, if you take this every day of your life, is it's guaranteed 1 in 100 patients who are taking this will have a stomach bleed. That means you'll end up with a bleeding ulcer in a merge. The typical symptoms that you see if you do have a stomach bleed is if you're nauseous and throw up, they look like coffee grounds. Otherwise, your stools turn black. The only other time your stools turn black is when you're bleeding internally, or you're taking iron pills. Iron pills will make your stools black. If you see those symptoms, and you with or without stomach pain, definitely get a hold of your physician. Get in to get tested. You're just taking the medications, the Advil, the aspirin, Aleve, according to directions. You still may have this stomach bleeding. One of the newest drugs in the market. It's extremely effective at controlling pain, and with the fewer side effects: drowsiness, dizziness, confusion, to go with the pregabalin or Lyrica. Unfortunately, it's not normally covered by Pharmacare or the drug plans in most provinces. Now, non-drug means to control the pain. Number 1 that I find is the far infrared saunas. I know you can look them up on the net and buy them. They range anywhere from $1,000 to $5,000 typically, and they do a phenomenal job at control. Typically in your local area, some naturopath, homeopath, occasionally health food stores have saunas you can visit. Even spas have saunas that you can visit, and test it out, see if it does control your pain before you buy. Now, if you can't carry a sauna around with you because it works so well, you have a long extension cord. I do have a product called Thermoflow. It's made of a material that inside the thread is little ceramic beads that reflect your body's own heat back into your body. They look like these. It's Thermoflow. And how this product works, again, with the ceramic beads in the threads, it reflects the body's own heat at the right frequency, because your body's heat is the perfect frequency to reflect back on your body. And just like the sauna, it stimulates blood flow to the area, the Thermoflow or the sauna, and it helps get oxygen into the cells for the healing, brings nutrients to the area. At the same time, it opens up the body sewer system called the lymphatic drainage system, and drains away the pain chemicals. You know how that if you twist your wrist it blows up? If you put a Thermoflow wrap on your wrist, I know that within a weekend that swelling goes down. It's just a phenomenal product. Works on great on any other swelling that happens in the body, either from arthritis or varicose veins or injuries. Another non-drug means of controlling pain is by using an enzyme called Arthritis. Now, Arthritis has been around for many, many years, and it is able to eat up the dead tissue that happens when you have an injury or arthritis. So you've got arthritis, the body attacks itself, kills the cells, and instantly, once there's dead cells there, the body has a response. That's an inflammatory response, meaning the area swells up, it triggers the pain nerves, and you feel pain in that area. And that's what this Arthritis does. It eats up the dead tissue that triggered the pain, which caused the swelling, which gave you the, triggered your pain sensors. So by getting rid of the cause, we've now stopped your pain. If you take the Advils of the world, or Aleve, or ASA, all that's interfering with is the body's inflammatory response. It's like putting perfume on top of a bad smell. What really works is having a bath with soap and water, getting rid of the smell. That's what Arthritis is. It's the soap that gets rid of the dead tissue inside your body. Now, the next thing is, typically there's muscle and joint pain. Part of your pain may be due to tight or cramped muscles. If you had an injury and the trauma is still there, your muscles are still tight. One of the best tools that I've ever seen is called the stick. And this stick is anywhere from 20 to 30 inches long. This is a marathon stick. It's 20 inches long. This is what about 90% of my clients purchase to control their pain. You just roll it. And you roll it over the muscles, and you'll see how it's to be used at the website. So this is the stick, and typically all you ever do is you can just gently roll it up and down on the area, and I'm just doing my arm, because if you got neck pain, if you got a frozen shoulder or shoulder injury, using 1 or 2 pounds of pressure, you just roll this area up and down for 30 seconds, and I absolutely guarantee that you will increase the range of motion. You can only lift it. If you can only lift it this high, you'll lift it to reach your head. I've had clients do that in the first application of using the stick. It's 100% money back guarantee, 90-day money back guarantee on the stick. Thank you for watching this video. My name is Alan Glasser, pharmacist, Mark's Pharmacy in Delta, BC. You can visit the website at www.fast-arthritisrelief.com. That's fast-arthritis-relief.com. And again, you can get a hold of me directly at 1-877-596-1774. I do personal consultations. 20 minutes is $50. Please call to inquire.